Welcome to another deep dive. Today, we're going to be unraveling a very perplexing medical case. It involves a Basenji mix with some pretty unusual neurological symptoms.
This case is a fascinating diagnostic challenge.
It really is.
We're looking at a 3-year-old spayed female Basenji mix who first presented back in May of 2023 with a history of what we call waxing and waning vestibular signs.
Waxing and waning, what does that mean?
So basically, she was having these episodes of head tilt, difficulty walking, just a general lack of coordination, and these episodes would kind of come and go.
Like almost on a cycle? Like every few months, every few weeks?
Yeah, it could be. It varied, which made it really difficult to pinpoint what was going on.
Yeah, that makes it really hard.
And to add to the intrigue, there was a notation in her medical history from about 18 months prior that mentioned hyperglobulinemia.
Hyperglobulinemia, what is that?
That means elevated blood protein levels.
Okay, so something was going on, but they didn't know what.
Yeah, right. And that detail, it'll come into play later. But for now, let's focus on what happened in September of 2023 when her symptoms took a turn for the worse. So she started exhibiting nystagmus.
Nystagmus.
Yeah, it's a condition that causes rapid involuntary eye movements.
So like her eyes are just kind of like flitting around back and forth.
Yeah, exactly. And this prompted her owners to seek out a veterinary neurologist.
Okay, so at this point, the neurologist steps in. What's the next step?
Well, first things first, a thorough neurological exam.
Of course. Got to start with the basics. So what did the exam reveal?
The exam showed some very specific findings. The dog had a noticeable left head tilt.
Okay.
And she was ataxic in all 4 limbs.
Ataxic meaning?
Meaning she had trouble coordinating her movements, walking was difficult, and she was exhibiting that horizontal nystagmus that we talked about.
Right.
But the interesting thing about the nystagmus was the direction of its fast phase.
Okay.
It was primarily to the right, but occasionally it would shift to the left.
Why is that important?
That shift is a key clue. A shifting fast phase in nystagmus, it strongly suggests that the problem, the lesion, the area of damage, it's located in the central vestibular system.
So the brain.
Parts of the brain, yeah, like the brainstem and the cerebellum.
Okay.
This helps us rule out problems in the inner ear or the vestibulocochlear nerve. Those typically present with a more consistent nystagmus pattern.
So by seeing that shift in her eye movement, the neurologist was able to kind of narrow down the location of the problem within the nervous system.
Exactly, like piecing together a puzzle. Each clinical sign gives us a piece of information, helps us form a clearer picture.
Right, get a better idea of what's going on.
Right. Based on these findings, the neurologist came up with a list of possible diagnoses. High on that list was meningoencephalitis.
Meningoencephalitis, break that down for us.
It's inflammation of the brain and the membranes surrounding the brain. There are a lot of potential causes for this, including bacterial, viral, fungal, or even parasitic infections.
Okay.
Another possibility was neoplasia. The fancy medical term for a tumor.
Okay.
Could be a primary brain tumor or one that spread from somewhere else in the body.
So we've got a lot of suspects,
Yeah.
but no clear culprit.
Right.
Where do they go from here?
Blood work. Remember that hyperglobulinemia from her history?
Yeah.
Well, her total protein levels, they were still high, and they couldn't get an accurate globulin measurement. This supports the possibility of, some underlying condition that's causing this persistent increase in these blood proteins. To get a more detailed look at what was happening inside her nervous system, they decided to go ahead with an MRI.
An MRI, that often can be the game changer. What did the images show?
This is where things get really interesting.
Okay.
The MRI showed marked cortical lysis in the C7 and T1 vertebrae.
Cortical lysis, what does that mean?
It means there was evidence of bone destruction in her spine.
Oh, it's not good.
No. And then there was the discovery of a large mass, and it was located in the 4th ventricle of her brain.
A mass in the brain.
Yeah. And this mass had some odd characteristics. It appeared T2 hypointense on the MRI.
T2 hypointense.
Meaning it didn't light up as much as you would expect. And it also showed strong contrast enhancement, suggesting a high degree of vascularity or cellular activity.
So a mass in the brain, bone destruction. It sounds really serious.
It was definitely very concerning. These MRI findings, they pointed towards several really big problems. Firstly, the mass itself was taking up space in the 4th ventricle.
Right.
And there were signs of focal meningomyelitis,
Which is?
inflammation of the meninges and the spinal cord in that specific area. Secondly, this mass was blocking the normal flow of cerebrospinal fluid, leading to something called obstructive hydrocephalus.
Obstructive hydrocephalus, what does that do?
It's a buildup of fluid in the brain.
Okay.
And then lastly, those patchy areas of hyperintensity along the brainstem and the spinal cord, they raise the possibility of syringohydromyelia.
Yeah, I'm going to need you to break that one down for us. What is syringohydromyelia?
It's a condition where fluid-filled cysts form within the spinal cord.
Oh, wow. So the MRI is painting a really grim picture here. You've got the mass, you've got the inflammation, you've got fluid buildup. It just seems like a cascade of complications.
Yes, it was a very complex situation. To look further into the possibility of an infection, they ran a serum neurologic PCR panel
Okay.
to test for common infectious agents like Anaplasma, Ehrlichia, and Rickettsia. However, all of those tests came back negative.
So not a slam dunk answer, but it doesn't necessarily rule out infection completely, right?
Exactly. A negative test doesn't always mean an infection isn't there. It just means that the specific thing they were looking for wasn't detected at that time.
Gotcha. So while it gives us some information, it doesn't solve the whole mystery.
Right.
So what happened next? Did they try any treatment at this stage?
Yeah, they did. Even without a clear diagnosis, they started treatment based on what they were seeing, the clinical signs and MRI findings. The dog was started on dexamethasone.
Dexamethasone, that's
It's a corticosteroid, helps reduce inflammation, and also meclizine.
meclizine. What's that for?
It's often used to manage vestibular symptoms, so, the head tilt and the dizziness.
So trying to manage the symptoms
Yeah.
and hopefully buy some time while they figure out the underlying cause.
Exactly. And initially, there was some improvement. Her vestibular signs seemed to get better, gave some hope that they were on the right track. But sadly, it didn't last.
Oh, no. So she got worse again.
Yeah. After about 3 weeks on the medications, her condition started to go downhill. She began having focal seizures.
Focal seizures, meaning?
Seizures that affect only a specific part of the brain. And she also showed signs of what they thought was pretty severe neck pain.
Oh, so they were back to square one.
Kind of.
Yeah.
Faced with her worsening condition, the lack of a clear diagnosis, the really tough decision was made to euthanize her.
I can't imagine how hard that must have been.
It's never easy, but it sounds like they really explored all their options and chose the kindest path.
Yeah. But the story doesn't end there.
Right. They performed a necropsy.
A necropsy, that's an autopsy, but for animals.
Exactly. That's where they got some real answers.
Okay, tell me more.
The necropsy and the histopathology, which is the microscopic exam of tissues, it revealed severe chronic pyogranulomatous meningoencephalomyelitis.
Wow, that's a mouthful.
Yeah, it's a long one. But basically, it means there was widespread inflammation with pus formation in the brain, the meninges, and the spinal cord. They also found osteomyelitis,
Which is?
inflammation of the bone, and myositis, inflammation of the muscle.
So inflammation everywhere, nervous system, bones, muscles. What was causing all of this?
Here's the shocker. Within these lesions, they found fungal spherules. These are structures that are characteristic of certain fungal infections. In this case, it pointed towards coccidioideaposis.
Coccidioidomycosis, also known as
Valley fever.
valley fever. Hold on, I thought her tests for infectious diseases came back negative.
I know, right? It's a real head scratcher. But this case really highlights that diagnostic tests, while helpful, aren't perfect. There's always a chance of a false negative.
False negative meaning the test says it's not there, but it actually is.
Exactly. In this case, it's possible that the amount of fungal DNA in her blood was too low to be picked up by the PCR, especially early on in the disease.
So the negative test didn't rule out a fungal infection. It just meant they didn't catch it at that point in time.
Right. And thinking back, there were a few things about this case that, looking back, weren't typical for nervous system coccidioidomycosis. First, the location of the lesions was strange. Coccidioidomycosis in the nervous system usually affects the supratentorial region. That's the area above the tentorium cerebelli, which separates the cerebrum from the cerebellum. But in this dog, the main issue was in the fourth ventricle, below the tentorium cerebelli.
So the location was kind of throwing them off. Anything else unusual?
Remember we talked about the mass in the fourth ventricle being T2 hypointense on the MRI?
Yep.
That's not typical with valley fever either. Usually lesions from this fungal infection appear bright on T2-weighted MRI images.
Interesting. So why was this one different?
Could be because of what the lesion was made of. T2 hypointensity, sometimes you see it in granulomas. Those are these collections of immune cells that form in response to long-term inflammation. So in this case, the fungal infection caused a big inflammatory response, which led to a granuloma with a thick, fibrous capsule. And these kinds of granulomas, they can look dark on T2-weighted MRIs.
So it's like her own immune response was creating a sort of optical illusion on the MRI.
Right, making things even trickier. And remember that hyperglobulinemia from her history. Turns out that fits in perfectly with a coccidioidomycosis diagnosis.
Oh, right. We talked about that earlier.
Yeah.
How does that connect to valley fever?
Hyperglobulinemia is actually pretty common in dogs with coccidioidomycosis. The immune system is working overtime to fight the infection, producing a bunch of antibodies. Those are proteins that float around in the blood. And this increase in antibody production, that's what leads to the elevated blood protein levels.
Wow. So that one lab result from over a year ago, it was actually a clue all along.
It really was. It shows how important it is to look at the whole picture, the entire medical history, even things that seem totally unrelated. Sometimes those little details can be the key to figuring everything out.
That's incredible. Any other interesting points about this case?
Well, there is one more thing. The dog's owner, they actually had a history of coccidioids pulmonary granuloma.
Really?
Yeah, it's a lung infection caused by the same fungus that the dog had. The owner had been treated for it before, but it makes you wonder if there was something in their environment that put both of them at risk.
Wow, that's amazing. It really highlights the connection between human and animal health, especially with zoonotic diseases like valley fever. It reminds us that what affects one can often affect the other.
Exactly. It emphasizes the importance of a One Health approach, recognizing the link between human, animal, and environmental health. By understanding those connections, we can get better at preventing and controlling diseases that affect us all.
We've learned so much from this challenging case. It really reminds us to stay curious.
Right. Question everything and be open to the unexpected, especially with infectious diseases.
And this one certainly threw us for a loop. Not your typical valley fever presentation.
Definitely not. We usually think of valley fever as a respiratory thing, mainly in the lungs. But this shows that it can affect other organs, like the nervous system, and in ways we don't always see.
It reminds us that infectious diseases can be really complex.
Absolutely. So many different ways they can show up. That's why it's so important to have a thorough approach when diagnosing. Consider all the possibilities.
Well, I think we've covered a lot today. We've gone through all the details of this case, from those early confusing signs to that surprising diagnosis of valley fever.
Yeah.
And we've seen what it teaches us about being thorough, looking at the whole patient history.
Right.
And the connection between human and animal health.
Yeah, it's been a fascinating deep dive. This really was a remarkable case. It shows how important it is to be careful, to be adaptable, and to keep an open mind.
Absolutely. And on that note, we'll wrap up this episode of The Deep Dive. From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.